Alrighty, good afternoon all, and thank you for joining us for another Secret Sunday session today. Today I am joined with Belinda from Healthy Hormones, so she's written her own book, and then we're also going to talk to Belinda today a lot about hormone health and how the hormones work in the female body. So just to start off, Belinda, who are you and what is it that you are doing?
Thank you. Thank you for having me. My name is Belinda Kirkpatrick. So I'm a naturopath and a nutritionist. I've been working in clinical practice for over 15 years, and I've got a special interest in hormonal health, reproduction, fertility, periods, all those kind of girly things. So I do also see general practice as well, but the kind of the bulk of my practice is really centered on hormonal health. I've got a master's in reproductive medicine to kind of take me a little bit further into it all. As you mentioned, I've got my book, Healthy Hormones, and I'm also the creator of some of the online courses on nutrition, IVF support, and fertility as well. So, I guess, this is my passion area, and I love talking to people like you who are into hormonal health and really helping women to understand their bodies a lot more, and be able to listen to the signs or see the signs that our bodies are telling us, so that we can kind of be in our best health and feel our best, which is what it kind of comes down to. It's not about having the perfect hormonal balance. It's just about feeling your best and having your body functioning at its optimum, so that you can attack every day and feel good.
Awesome. So I guess we'll dive straight into it then. And what are hormones?
Yeah, good question. So hormones are these chemical messengers that are released by different glands in the body, and they'll go around giving different signals to different body parts. So for example, a lot of the time I'm talking about reproductive hormones. So things like estrogen and progesterone that are produced in the ovaries, but also talking about things like thyroid hormone or melatonin, your sleep hormone. So these are produced in different glands. Your thyroid helps to, regulate everything from mood, temperature, metabolism. So there's so many hormones that we've got in our system, even insulin, which you've probably heard of before, which helps to regulate the way that our cells utilize glucose. Some of these sort of things that we don't even think of maybe as hormones, are also kind of hormones in our bodies. They're basically just helping our body to be able to function and do what we need to do.
Wow. And if I dive a little bit into as well in our aspect when we're talking about eating disorders, normally one
Mm-hmm.
of the first symptoms is you lose your periods in
Yeah.
some cases. What is happening in the body during that time when, a period is lost?
Yeah. So basically, we've got this gland in our brain called the pituitary gland, and it's responsible for giving our ovaries messages, things like LH or luteinizing hormone or FSH, follicle stimulating hormone, that says to the ovaries, come on, increase some estrogen, start to get an egg ready for maturation, and then we ovulate, and then we have a period. A couple of little things happen in between, but that's the gist of it. So when we do have disordered eating, weight loss, carbohydrate restriction, could also be extreme stress. It could be over exercise. And sometimes these things are really blatantly obvious. It's like you've been diagnosed with an eating disorder, or you can recognize in yourself that you have that. But quite commonly with lots of people too, it's these kind of very subtle, what I call disordered eating rather than eating disorders, where it's like, quite severe carbohydrate restriction, or, but maybe still eating enough other things, or it's not that different to what other people are doing. Maybe you're doing some fasting or whatever. There's all these little loopholes that our brains try to kind of get around that end up being some kind of disordered eating. So what happens is that your brain, your hypothalamus gland that controls the pituitary gland, the brain says, hang on a second, this is not safe. Something is going on. We're in a famine, guys. Like, do not have a baby. This is a bad time to have a baby. There's not enough food around. Maybe there's lions circling the cave or something. Like, I don't even know. This is no good time. We're freaked out. So what the hypothalamus does is the pituitary gland then says, okay, let's stop secreting as much LH and FSH, which then says to the ovaries, oh, we're not doing anything. We're packing up shop. Okay, cool, no worries. And then the ovaries don't produce very much estrogen, and therefore we don't ovulate, and therefore don't get a period. So it really comes back to kind of our bodies feeling safe. and sort of having enough food, not being super restrictive, so that our bodies can actually go, no, this is a safe time to have a baby. Because even though a lot of you may not be thinking about having a baby at sort of certain times, it is still basically, that's why we ovulate and get periods, is for reproduction. Now, there's so many other benefits of having periods. Estrogen helps to keep our hair and our skin and our mood really great. It helps to improve our cardiovascular health. It helps to keep our bone density nice and strong. So it's not just for reproduction, but that's what the body's kind of doing when it's wanting to ovulate.
Wow.
And the trickiest part, I think, that people are in their recovery journey find, because I see lots of clients in this situation, is they're like, no, I'm so much better now. Like, this is what I was doing before when I was sick. This is kind of what I'm doing now. I still don't have a period. What's going on? And often, and this is the part that's really difficult for people to get their heads around, this is not everybody, but often your body actually needs you to be more safe than somebody else who hasn't been through that unsafe experience. And so you actually need to do more to make your body feel safe. So whether it's eating more carbohydrates than somebody else or exercising a lot less than somebody else, and the way that I often explain it to my clients, and maybe this is a terrible analogy, but I'm going to just run with it anyway. So is like, say, for example, you've never been cheated on by a partner, right? You just have trust and you're kind of fine, and that's kind of great. You have somebody else that has been cheated on a numerous times, or maybe even once, and then they meet this new partner and they're still not very trusting, right? Like, hopefully they've like done the work and they've moved on and they're all better. But let's face it, we carry that crap on to the next one usually. So that's you, go see a psychologist, do the work. But most of us are carrying it on. So that nice person has to kind of work twice as hard to regain our trust, right? So like, oh no, I'm just going out for a beer, I'll be back at 9, and then be back at 9, whereas the more trusting person, they don't need to know where that person is all the time or whatever, that everything's just a lot more kind of free and easy. But because somebody's had that negative experience, they require more trust, like more input, more sort of reassurance to go, okay, no, this is not happening again. No, everything's kind of fine here. And it's like that with our bodies. So, our bodies often require way less exercise than what you might see friends doing, or having to eat more regularly or more carbohydrates than what you see somebody else doing, because we've got to regain that trust of the body.
Yeah, wow. It's incredible how, that body comes back to you. Just need to really trust it, and it needs to take time and that patience. Because I know as well, like, sometimes when you are regaining your period, you can have a lot of abnormalities. Is that right?
Abnormalities?
Yes, that's right. Well,
Same thing.
Yeah. So if you have, for example, spotting here and there, and then you might have a period and then lose a period, is that normal?
Yeah, that's great. You're on the path, right? So the thing is that you go from not getting a period at all, which is your body's in that state that it doesn't feel safe, to then different points of time where, if you're getting a little bit of spotting, or you get a period, or maybe you're even just noticing some changes in your cervical mucus. So as you might know, when your estrogen's very low and perhaps you're not yet in recovery, you often won't have very much sort of mucus being secreted from your vagina. Once you start kind of, normalizing your body weight a little bit more, and you start kind of, recovering a little bit more, which is great, your body will start to increase a little bit more estrogen. And you might find that you're like, it still might not be sort of what you'd call fertile mucus, but you're like, oh, there's a little bit more of that sort of white, thick moisturizer cream. Like, I'm just getting a little bit of that. It's not much, but it's a little bit. I'm like, great, that's fantastic. That's your body starting to increase a little bit of estrogen, which is sort of the first step to, at some point, getting a period. So sometimes you'll get that spotting because, your hormones are changing and fluctuating. And that's a really good sign, because I say to a lot of my women, you've got this first period, that's amazing. And often that happens, relatively, not easily, but we get that happening. And I'm always saying, like, please don't worry if the next one doesn't come in a month or two. Like, it's okay. We're moving in the right direction. We know it can come back and it's going to happen. We just need to kind of now build that trust, so to speak. So, even if it doesn't come back super regular, we're moving in that direction. And what a lot of my clients, because I mean, as you probably are very aware, a lot of this is a very long-term journey. And even when you're potentially sort of fully recovered, you're often not, if that makes sense. So you might be fully managed in terms of your diet and exercise is, considered to be very healthy, but it's often having to continually think about that and realize that little things have happened to slip back in, often under the guise of something healthy. I'm just going to take out gluten because actually, like, I read that gluten isn't great for some, these things sleep. Yeah. I'm always like, is this a loophole? Are we just looking for a loophole here to kind of like, just make some rules. We want to make some rules, and that's okay. We can make rules about other things. So what often happens though is that I'm always kind of documenting and recording, what was happening, because often when I first see somebody, they can take a lot of things on. They're very committed. They want to get their period back. And then sometimes over time, their period might come back. And then sometimes over time, they're sort of like the back of their mind, they're like, oh yeah, it's back now. So, maybe exercise kicks up a little bit, maybe their high intensity sessions are a little bit more increased and the long walk on the beach gets dropped, or, maybe the afternoon snack gets dropped because I didn't really feel like I needed it. Like I wasn't really hungry. Fine, right? Like sometimes that's the case. But if all those things change and the period goes away again, I'm always kind of coming back to, okay, so what were we doing? We as in you. What were we doing? It's nice to be a team. When it was back, okay, like let's start to just really gently move back towards those things. And I think the most important thing to remember is it's all a journey, right? You're going to have blips. There's going to be ups and downs. That's okay. Like that's called life, right? It's just about recognizing, like, okay, I was getting a little bit more cervical mucus and I was starting to notice like a couple of things. They've all gone away now. Like, not, and is that my fault? Or gosh, what have I done? Idiot me. But more like, okay, let's just me have a little bit of a look at what's been going on. You know what? Work has been a bit more stressful recently. And I actually did stop like taking my snacks to uni because I've like been tired. So I'm in a bit of a rush. So there might not even be conscious things, but sometimes we can look back and go, yeah, okay, there have been those kind of changes. I'm just going to check in with myself and then sort of come back to the things that I know that I need to do.
Wow. Do you think like hormones are very sensitive in that sense though, that like if change happens, then they react straight away?
Some people's hormones are very sensitive. Yes. Yeah. Some people's are just that person that will just never, ever forget that they've been cheated on, and everyone's going to pay the price forevermore, Other people, and obviously this has got nothing to do with your brain and your mind. It's just different kind of like genetics. Other people that you probably know, continued to menstruate through like, terrible kind of like parts of their lives when really their bodies probably were the opposite of, a good place to house a baby, which is if we look at the purpose of reproduction, so some people like, yeah, that just isn't one of their symptoms, right? I mean, a lot of people it is, but some people's will come back kind of quite quickly. And some people, I certainly work with girls. I mean, look, probably the people I don't work with long term, the periods have just come back and they're off just living their happy, healthy hormone life. And that's great. And the people that I probably speak to a little bit more frequently, there definitely is that, oh yeah, stress has kind of increased. Actually, I did kind of pull back a little bit on this. Normally it's the exercise that creeps in for a lot of people. It's the oh no, I just signed up to like F45 last week, and not that I'm against F45 at all, but like I'm like, oh, okay, I thought like we talked about like Pilates and 2 full rest days and a long walk twice a week, and like, oh no, but there was like a discount and I'm going with my best friend. And it's always really hard to kind of know, and I work very closely with psychologists too, so that's kind of more their jam, but like hard to know when is a healthy habit starting and when is a guise that, and it must be tricky for those people as well, right? Because like, well, all my friends are joining, we're all going to boot camp first thing in the morning. Like, well, everyone's doing that. Everyone's healthy and normal and having their periods and like, no big deal. Like, why am I the one that should just stay in bed and do a meditation and then go for a walk and get on the foam roller? like it's, so it
Do
can
you-
feel really unfair.
Yeah. Do you think that's where it's hard to, I guess, have that balanced, healthy hormones, because hormones are almost fighting the diet culture that we're exposed to, in the sense of like that vigorous exercise, and we must do that.
Yeah. So look, there are also a lot of people who need vigorous exercise to get their hormones in shape, right?
Yeah.
So this is the kind of thing where we need to kind of like, which health advice is for us, and which health advice are we taking? Yes, people eat too much sugar. Yes, most people eat too many carbohydrates. Most people don't exercise enough. Most people overeat, right? So if we listen to their messages, right, the messages that are coming out for the majority of people, it's eat less carbs, eat less sugar, stop overeating, exercise more. We're like, oh, well, I'm going to do all those things because I want to be healthy. And it's like, but they're not the messages for you, if that makes sense.
Yeah.
Do you know what I mean?
Yeah.
And that's the part that is very difficult, because there's people that need to listen to those messages and don't. And there's people who really don't need to listen to those messages and do.
Yes.
And it's hard to give a one size fits all message approach. So I guess it does kind of go against with sort of diet culture. But for a lot of women, they might be having fertility problems or period problems because of excess body fat, because of insulin resistance, because of pre-diabetes, because of a lack of exercise. So like you wouldn't go into the pharmacy and just take any medicine because you didn't feel that well. You'd be like, hang on a second, I need to find somebody to tell me, why I'm not feeling well, what this could be, and then what would be my treatment for it. Right? I'm not just going to go into the pharmacy and grab blood pressure pills because I've got an itchy foot, So
Yeah.
if we start to think of it a little bit more like that, then it's like, okay, so different bodies and different people have very different needs. So to listen to a mass marketing approach, but it's hard not to, right? You scroll on Instagram, you go here, you go there, and it's like you're getting these messages, which is why your stuff's great, right? Because what you see, this is the crazy thing about today's youth. I can say that now that I'm like 41. No, but it's crazy. So my Instagram, I feel like everybody's like super into like meditation and like motivational quotes and like, like fertility and stuff like that. No, like I look at my teenagers' Instagrams account, they're 16, 18. They're not seeing any of that shit. Right. So we curate by our interest what we see, right? Yeah. So when you're following Instagram accounts like yours, for example, or more either recovery accounts, or not even doing that, but focusing on your interest. I love painting accounts and artistic people and holidays in New South Wales or wherever you are, like, whatever it is. If you start curating your content to that, and that's what you're searching in Google and that's what you're looking at, all of a sudden that diet culture goes away.
Yeah. Oh, definitely.
Which is crazy, right? Like it just goes. It's not even there anymore, right? Like, not many people buy a magazine. Like, who even watches an ad on television? It's so we actually are in control of what we see. It's just so hard to control.
Yeah. And especially, I think, to educate people at the younger ages to look at something like healthy hormones when they just go, well, I just want to lose weight, just give me the quick fix. Instead of
I just want to look good, I just want nice skin and
bikini body.
Yeah. Nice skin, be skinny, and that's it. Like, well, it's not until you unfortunately realize that the pursuit of those goals can be a very dangerous pursuit.
Yeah.
That then you become interested in kind of other things. But I do think, though, I have to say, this is not everybody, but I do think I see in my clinic a lot more younger people. When I say younger, like early 20s, obviously coming to see a naturopath, who are wanting to, like, make sure their hormones are really good and, like, not be on the pill if that's not what they're wanting, and to make sure that their bodies kind of like are okay. So I also get lots more teenagers coming in with their mums, like, for, really, and like sometimes it's tricky because like the mum is usually a lot more motivated than the teenager. Not always, but often, so when you're trying to do food and lifestyle stuff and, like, they're happy to take a couple of supplements usually, but they don't always stick to the recommendations, which is cool. You don't have to be perfect, but I do think there, and probably because of what you're doing and people like you, there is more interest, I think. And again, maybe that's my little kooky world that I've created for myself online, where people I feel like, look at that young girl, she's so interested in this.
Yeah.
I'm missing the other 50 million that are totally not interested.
Yeah. So I'm interested to know, as a mum, how do you educate and inform your children about healthy hormones and get them interested in that space instead of the diet culture space?
Yeah. Look, I think because I work so much with hormones, it sort of just infiltrates in a little bit, and they don't ask that much anymore, but they used to be like, what do people come to you for and stuff like that. Not that I tell them all the details, obviously, but it's like, oh, okay, they wanted to have a baby, but maybe they couldn't because of this or whatever. So in an age appropriate kind of way, which was often kind of a bit of a conversation that would kind of come up when, some of their friends would go on the pill for their skin at 14 or whatever. I'm like, I hate to say it, but these are my future clients at 35 who are desperate to have a baby and are not getting their period back after being suppressed on the pill, right? There's times when every medication is worthwhile taking. There are people that are probably better off being on the pill for whatever reason, but it's not for everybody, and it's not necessarily at those ages when your hormones are very kind of sensitive. So part of it's probably that. Part of it too is I developed an iPhone app called Seed, which is like a period tracker. And, a lot of people were taking, they're putting their symptoms into trackers. Like, I had a headache, I was moody, whatever, I was spotting, but not then knowing what to do with it. So I wanted to kind of create this app that you put in your spotting, and then it gives you a recommendation that you can do at home to improve those symptoms, right? So you're actually doing something with this data rather than just collecting data for fun. And it's got supplements and diet and all that kind of stuff on there as well. Bit of a hormonal health quiz and what have you. So, I guess as I was they would use that as well, so they kind of understand. And I've always sort of talked about periods and cervical mucus and ovulation as all part of this very normal kind of cycle, rather than people learning about cervical mucus and ovulation when they're 35 and want to have a baby, or 42 and want to have a baby. It's like, what? Why didn't anyone teach me this? And it's like when would have been the right time? Because when you learn about periods at 11, you didn't even want to know about that then. I'm pretty sure that you don't really want to learn about cervical mucus at school when you're 14 either. Kill me now. Do you know what I mean? I don't know. Maybe you do, yay for you. But on the whole, I don't know if you do want to hear about it then. So I think though it's me, it's you, it's people who are interested in this, that we will then tell our children. To me, this is information that women should pass on to each other, right? Our women's wisdom, that at an age appropriate time for your children or whoever you're kind of around, you're able to share this information, and then they would then share that on with their kids. So it won't be why didn't I learn that in school? That's so annoying. It's kind of oh, what, your mum didn't teach you about that? When what the importance of these kind of events in the cycle and understanding your cycle and your body a little bit better. So I think it's kind of, hopefully by the time the next kind of generation comes, more women will be understanding about this stuff, and we can kind of pass on this information and have this kind of women's wisdom about their bodies, rather than being super disconnected from our bodies, which is kind of what has been happening up until fairly recently.
Yeah. Why do you think that we've become so disconnected with our bodies and almost ignored our body's signs and symptoms that it tells us?
Yeah, that's a great question. I wish I knew. I think, look, partly could be because the way that medicine tends to work. And look, I'm super into medicine in terms of, if I need, an operation, give it to me. If I need antibiotics because I've got a systemic bacterial infection, give them to me. It's not that I'm anti that, but I think in medicine, the doctor's job and their degree, Bachelor of Medicine, is to diagnose disease and prescribe medicine, right? Yeah. So it is seen everything mostly, not always, in isolation. Here's your gynecologist for your hormonal stuff. Here's your, endocrinologist for your thyroid and hormones. Here's your neurologist for your brain. So we're kind of bitsy kind of things. And often when people come into my clinic, I'm asking them what are your bowels and what are your mood and what are your sleep and what's your skin? And often they're like, oh my gosh, there's so much wrong with me. I feel this is so full on. And it's like, but that's because it's the first time that anybody's asked you all the things together. And often I'm like, okay, you know how you said you get like really bad PMS, you get leg cramps, you get a twitchy eye, you've got headaches, you don't sleep well, you crave chocolate, and you've got anxiety. I'm like, yes, I'm falling apart. I'm like, they're all symptoms of low magnesium, right? So sometimes, like, when we look at things holistically, we can tie everything back into just one or two little neat packages, or these are all symptoms of autoimmunity, right? And you know you've got X autoimmune condition, like, oh, I didn't kind of realize that. So I think because of the way that medicine is, it's often we're sort of taught to compartmentalize things a little bit rather than seeing things as a whole. But I also kind of think, particularly with like women and hormones, it's always been such a like all hormones. It's like a secret taboo kind of topic. And look, to be honest, that's what gut health was 5 or 10 years ago, right? No one was talking about gut health. No one was talking about poo. No one was talking about the importance of your microbiome. And then all of a sudden, like gut, you can use the word gut and poo in the media, and maybe they use the word poo, but like, I mean, they talk about it, right? Though, like it's a thing. It's so important. And so I think hormones is just having its little renaissance like those things have, whereas like this is not something to be ashamed of. Yeah, we get periods. Yeah, we ovulate. Yeah, we have cervical mucus, you know, or we lose our periods when this happens, or you know, if we get stressed, that can impact our bodies in this way. So I think it's kind of sort of slowly changing, but I think it's kind of been a bit of a, all hormones, oh, that's embarrassing, you're hormonal. Is that what you mean? You know?
And there's that big stigma that like women are so hormonal, or when you get your period, you're like, oh, you must be in a mood. Like, why has that sort of occurred? Why do we just label women as being hormonal?
Oh, it's such a patriarchal thing. Don't even get me started.
I get so angry about it when someone's like, oh, geez, you're hormonal today. And I'm like, don't even
start. And then you get your period and you're like, okay, never mind. But you know, so the thing, look, there's a couple of things with it. The thing, like this whole sort of like patriarchal kind of like thing with it is that like a hysterectomy, right, when a woman gets their uterus removed, is called that because it's taking the hysteria out of women. So they won't be hysterical anymore. When such a bad word, they need to change it, right?
Really...
But that's where it kind of comes from. So it's like there's this whole kind of like stigma of women, but part of it, not part of it's true as in like we're hysterical, but like there are mood changes that get associated with us hormonally. And the thing is with men, they have different kind of times when their mood can kind of be affected by hormones as well, but it's over like a lifetime. It's not like every month, you know. So if men were having high and low testosterone at different times of the month, if they had times of the month when they felt really energetic, you know, their libido was really high, you know, they felt really strong, they could exercise, they didn't get tired, but then they had this time of the month when they were just like really like, you know, like low libido and kind of like, you know, weak, they couldn't go to the gym, they were like really tired, they got sick often and things like that. It would be, oh, okay, we get it, there's these hormonal fluctuations. So, you know, but with women, because we're circulating, you know, whether it's monthly or every few months or every 3 weeks or whatever it is, you know, there are mood changes that get associated with that. You know, estrogen makes us feel happy and great and gives us lots of serotonin, so that often in the middle of the cycle women feel great. You know, if progesterone's not high enough before our period, we'll often feel a bit more anxious and maybe our mood's a little bit lower and things. So, you know, it definitely, we do get affected by those things, you know, like why for the 3 days before my period comes, does like anybody eating just like piss me off? You know, I just going to hear them eating, right? And like, but yet the other 27 days of the year, everyone eats really, month, everyone eats really quietly. So I don't get it. Must it be me? But, you know, so there are these things that kind of happen. And if they were just a little bit more accepted, right? You know, it's just like, okay, like, yeah, that's what happens. It would kind of be better, you know. And there also are lots of things that we can be doing that help us to, you know, that can help to actually improve some of those symptoms. Sometimes they're low magnesium, low B vitamins, you know, we need to balance our hormones a little bit. So, you know, we should be able to kind of go through the month without extreme kind of mood stuff. But if you're just a little bit more energetic mid-cycle, a little bit more melancholy just before your period, it's also okay to just kind of accept that a little bit too if it doesn't interfere and it's just very mild.
Yeah. So is supplements necessary in order to have healthy hormones?
No, right? So people can like, have healthy hormones and do nothing and take nothing and whatever, right? Like unhealthy hormones or, unbalanced hormones or hormonal issues are not from a supplement deficiency, right? They may be exacerbated by a nutrient deficiency, sure. If you don't have enough zinc, enough B6, enough magnesium. So people who have maybe had disordered eating in the past or currently, like zinc is like low in like 400% of the time. No, 99. Let's give it 99% of the time. So there's lots of nutrients that might have been really depleted long term. So supplements can be useful whilst getting the diet, and the nutrition sort of back on track to really kind of get those people nutritionally replete. So if there's something kind of missing from the diet or has been missing longer term, so your bank account of that nutrient may not be kind of particularly high. Also, too, looking at, might be food intolerances, it might be the way food's produced, it might be your gut bacteria not absorbing things well. So you may actually need more than the required amount of certain nutrients. I mean, like iron, for example, really important for healthy ovulation, but people often don't really think of that, right? Like, I'm not even getting a period, my iron's like a bit low, but it's not that bad. I'm not losing blood, I'm not that tired. Don't worry about it for now. We'll sort it out later when I get my period back and we'll see if it's still low then. Well, no, you actually need iron for healthy ovulation. So there's sort of nutrients and things that come all the way back through that can be very, very helpful in helping to restore the balance. So I guess it's not so much they need supplements, but they need those nutrients, and sometimes having them in a supplemental form and a therapeutic dose can be really helpful.
Yeah.
Herbs are also like beautiful for hormones. There's herbs that really can encourage the production of luteinizing hormone in the brain to start to tell the ovaries, yep, it's fine to do those things. What's important to remember when you're looking in your kind of field is that you can't out supplement the basics, all right? So you can't just be taking all the right things and not be doing the things that you need to be doing. So that is, that kind of is important as well. So I think don't forget that, like you can be taking all these things that are meant to kind of help, that are meant to whatever, but if your nutrition and your sort of lifestyle aren't in line with rebuilding the trust for your body, then you're possibly, you're maybe not wasting your money, but we need to always do the basics as well.
How do you get all the necessary nutrients into one day? Because I know they say like have this much zinc, have this much iron, take this much carbs, protein. How are you supposed to fit all of that into one day when you kind of look at it? It's very overwhelming of how much you're supposed to take to be, I guess, fit in the healthy hormone spectrum.
Yeah, totally. I would say for people who've been along your journey, don't count it, right? Don't overthink it, right? My sort of thing is to have a source of protein, some good fats, something fresh with each meal and most snacks. For people who've had any type of disordered eating or lost their period, you also need to add a starchy carb in there, right? Again, most people don't need to have the starchy carb. They're eating too many of them, but other people do. So protein, some good fats, something fresh, and a starchy carb, that needs to be on your plate, okay? So if that's on your plate 3 times a day, and then if you want a snack or you need a snack or whatever, it's sort of still based around those kind of sort of healthy whole foods. If most of what you're eating, 80% of the time, right, is based on the protein, fats, fresh and carb, is mostly a whole food that like looks like it might have come from a farm at some point in the last, little while, not too much kind of like packet processed stuff, then you're going to be absolutely on the right track with the food. That's all I need you to think about with the food, right? That's it. Super simple, right? Remember when I say 80% of the time, right? So if you're having 3 meals a day, which you should be having 3 meals a day, there's 21 meals a week, right? So I'm terrible at maths, so let's just pretend there's 20 meals a week. You guys are not to skip one, but like let's just do it for me because I'm a bit special. So that would be 4 meals that you could eat whatever the hell you wanted, and you are still eating well 80% of the time. 4 meals a week. Geez, like that's a lot of cheat, but like that's a lot of whatever, right?
Yeah.
Even if you wanted to do 90-10, right? You still can have 2 meals with like whatever. Go out with your friends, pizza, pasta, ice cream, whatever you like, do whatever you want. Okay. So have the balance, have that balance. Okay. Being stricter doesn't win the race. Okay. And I know a lot of you listening probably are perfectionists. And if anybody wants a job, great, yay for you, because you're the perfect employee, right?
Yeah.
You're the yes girls. You're the ones that stay back and make sure that like everything's finished properly and perfectly and all that kind of stuff, right? So watch out, because some employer is gonna, I don't want to say use and abuse you, but like have some boundaries, learn to say no, don't be so perfect, right? Do the job well. It's not your, it's not your whole life to be able to go home, right? So it's the same with this. You don't get, your period doesn't come back because you did what I say perfectly. It actually doesn't come back because you do what I say perfectly, right? Like, because you're like, no, I've got to have the protein, fats, and fresh. I didn't go out because that had the weird oil in that salad and I can't go to that place. No, like that needs to be like, 10, 20% of the time, go with your friends, do whatever, have whatever. There is no, you don't have to make up for it. You don't have to like, do anything differently. You don't have to exercise more that day or whatever. Life takes care of you. Okay. Your body wants to go back to balance. So you will get all those nutrients that you need with the protein, fats, and fresh, and a starchy carb with each of those 3 meals a day. You don't have to count the amount and everything like that. You are best to probably see a naturopath or even a nutritionist to go, here's what I'm kind of doing and eating. Here's my story. If you've had any blood tests, you could bring those in. Is there anything you think that maybe I might be deficient in that would be worth me supplementing for? Are there any things that you can see that I should be adding to my diet, right? Not taking away from your diet. Is there anything that you can see that I need that I should be adding to my diet, right? I'm never taking away. Obviously for some people, yes, I'm taking heaps away. You guys, nothing gets taken away. You just only get added. So that person then who is trained, who has been to university for 4 years plus, who has had clinical experience, can say to you, yes, this is what I think you need. Like you would go to the doctor to say, what medicine do I need for X if you needed a medicine? You wouldn't just, hopefully you wouldn't just Google it and then just buy it off the internet. Like, oh, I think I probably do have a sinus infection. I'm just going to try to buy this antibiotic and just, I don't know, like this one looks like, people's got good reviews. I'll just grab that antibiotic. Oh, 5 days, 10 days. I'm just going to get 5 days worth. I think that's other people. My friend did 5 days and she was better, right? You just, like you're laughing because it's nuts, right?
I know, yeah.
So don't do that then with your supplements. So some people sure can, if you know that your brain already goes a little bit into, I need to do this perfectly, like what would be the best thing, and you're going to potentially, if you've got the potential to overthink that, right? So if you've had any sort of disordered eating in the past, maybe, not categorizing anybody, maybe you've got the potential to overthink now, how do I get all the good stuff in? How do I whatever, have somebody do it for you who's been trained, who is objective, who's not emotionally involved, who hasn't been on the whole journey with you, and say, yep, do you know what? This is what I think would be great for you. Yep, if you could add a few more nuts and seeds into your diet because you're kind of lacking some, good fats, and maybe that'll give you a bit of extra vitamin E, which will be great for your estrogen or whatever. Like you can go, yep, add a few of those in most days if you can. These ones are good for you, almonds, Brazil, whatever. Yeah, I'm just making this up, right? Yeah. Everybody's different. But you're like, oh, okay, so I'm going to add some almonds and Brazil nuts to my daily diet. The naturopath or nutritionist said I probably did need some essential fatty acids like fish oils, and I also probably need some zinc, and my blood test said I need iron. So I'm going to take those things because that's what they said. They said to take them for 3 months and then come back and reassess, and we'll kind of go from there, right? That way then it takes you out of Google. It takes you out of the overthinking of maybe I need that. Oh, hang on a second. Someone on the forum said that they took like, vitamin D, maybe I need vitamin D. Like, have somebody help you with that is the ideal kind of scenario.
Yeah. Oh, I completely agree. Like even going through my own journey, you always go to Dr. Google, just be like, I've got these symptoms, what's going on? Like
Yeah,
someone help me. And you get so overwhelmed and confused by all the information and different people's stories when
yeah.
it's reflecting yours, but at the end of the day, you're not the same person.
Correct. And you wouldn't do it with a medicine. So that's the thing. So it's, and look, my sort of recommendation, shouldn't say rule, with my clients is like no forums, right? And you can go to forums for support, great, but like not for diagnosis, not for just choosing a vitamin or choosing a medication or, whatever it kind of is, because you'll always find what you want to find. Does an itchy nose mean I'm infertile forever? Sure, it does. Yeah, like I found that. Like, does an itchy nose mean you're going to get your period back next month? Yeah, absolutely. Yeah, mine came back next month. You'll always find what you're looking for, right? It's just how far you're prepared to go before you find the answer you're kind of subconsciously going for anyway.
Yeah.
So forums are probably never the best places for that stuff. Um, most people who feel good aren't even on the forum. You're going because you don't feel good, something's wrong. And so you're going, and other people are going there too. So you're connecting with people who maybe aren't doing as well at the time. Obviously, depending on the forum, some are great support forums, and that's kind of different. But those ones where it's a bit more diagnosy and this is happening to me right now, when you're feeling great, do you go on there and say, "I just so you know, guys, I'm actually feeling great. Sorry, the rest of you are still feeling crap. I'm feeling great." No, you're off living your life. You're at the beach with your friends. Like you're doing whatever you want. So be careful with that. I think it's good to have some information, but if you know that you can get quite stressed about your health or your body or things, then you actually are better to kind of outsource it to professionals.
Yeah.
And I'm all for everybody being super empowered with their bodies and learning a lot and not needing that. But again, it's kind of coming from that, sort of, oh, sorry, I deleted that. Sorry, guys. I thought, that was kind of, I guess, again, it's coming from that message of what's good for everybody. Is that good for me or is that not good for me?
Yeah. Do you think the stress and restriction almost impacts your hormones even more?
100%. Yes. And there is something that we difficult to measure that happens um, when we're overlooking at things, right? So one of the first things, and obviously this depends on where people are in their journey and things like that. I'm like, oh, what are you eating? Like, I have, half a cup of oats with, 5 almonds. I'm like, are you measuring half a cup of oats? Like, yeah. And I'm like, I bet you, like within plus or minus 5 individual oats, if I said to you, here's the bowl you usually use in the morning, put half a cup of oats in it, I will bet you $1,000 you put half a cup of oats in it by just pouring it, right? You, you've done
Yeah.
it so many freaking times, right? Stop it. There is something about the body when you stop overlooking it, when you stop just like over managing it, it relaxes. And honestly, the amount of people that are eating the exact same thing but they don't weigh and measure anymore, their period comes back, right? It's like, what? It's like having a baby. Like if people have been trying, they're doing everything perfectly, like doing everything, and then they're like, screw this, we're going to go on holidays for 2 months and we don't want to try, I want to go and drink Aperol spritzers and like live my life and whatever, right? They often fall pregnant there. Now, you can't pretend like, oh, let's just go on holidays. I don't really care if I don't fall pregnant now. Like, I'm just going to like whatever. Like, if you actually still care, it doesn't work. This is the crazy thing, right? So there's something about when your body's watching it, when you're watching over your body, it's kind of like, oh, no, not now type of thing. And so all those little behaviors like, I exercise for exactly half an hour because I set the alarm because I'm not allowed to exercise more than that, but I also don't want to exercise less. So I'm going to set my timer for half an hour and I'd go exactly to then. There is something crazily, weird. I can't put my finger on it. That when people stop doing that and then it's like, I exercise for about half an hour. Maybe it's 5 more, maybe it's 5 less, maybe it's exact, who knows? Like it actually like improves things. So the stress element is definitely there. And even when you're not stressed, but you're over managing, if that makes sense. And
Yeah.
think of it like when you were younger, right? Like if your mum was like a full helicopter parent, like, you know, where are you all the time, da da da, like your level of stress, even if you weren't doing anything differently, but you just had to report in, you know, you felt like somebody was watching you all the time, like you're kind of in this state of like semi-anxiety, semi-hypervigilance. I've got to make sure I answer my phone. Like, you know, even your phone's on you anyway, like it'd be easy to answer, but you're like, I just got to check in case like mum's called or like, you know, whatever it is. It's that somebody hypervigilanting you. That's not a word either, but let's just run with it. Doesn't make you feel comfortable.
Yeah.
And so when it's our bodies, we actually ironically feel in our brain that it's more comfortable with the hypervigilance. I feel like, okay, the dietitian told me, the naturopath told me, somebody told me half a cup of oats or a full cup of oats with XYZ, that would be a good meal, right? So because I maybe don't trust myself particularly well yet, because I'm just getting my body's relationship to food again, I'm just going to do what they say. But so exactly. So we feel comforted, or you might feel comforted because your body, you're like being quite hyper vigilant, you know, no, they said that's a healthy thing, I can just keep doing that, great. But you're also making your body, even though your brain might feel comfortable with that, your body's kind of like, gosh, God, I've got someone on my back on all the time, the exact cup of oats, like the exact kind of thing, the exact kind of bedtime. So I'm not saying not to listen to the people that are giving you the good kind of like healthy advice. It's more about, I guess, going, do you know what? Like, and this is obviously at different points of your journey, right? Like initially you might need to do those things. Yep. So you're coming out of like a not great space. You've been, you know, advised that this would be good for your nutrition. Yeah, great. Weigh, measure, whatever you need to do, whatever you've been told to do. But at some point when you're further down the path and you've been doing that for days, months, weeks, possibly years, there's a time when we can just trust ourselves again.
Yeah.
And be doing the same thing, but without the perfectionism involved.
Yeah, wow. It's incredible just how the body works and how even, you know, having that person on your shoulder, it's almost like, yeah, we're not safe. Where there's someone
Yeah.
watching us, like,
Yeah. And even when it's you, like
yeah,
we're not safe from ourselves. Like,
yeah,
gosh, what's Belinda going to think if I don't weigh them, you know, don't measure the oats out in the morning, you know?
yeah,
And the other
yeah,
part is like, well, Belinda thinks that's great because like the nutritionist told Belinda to do that. But it's like, yeah, it's like your body and your brain having this kind of sort of, you know,
war.
yeah, it's like your brain is like the mom and then your body's like the 14-year-old. Like, no,
Stubborn and
screw that. Like, you
yeah.
know, I'm going to probably do what you're telling me to do anyway, but only when you stop telling me to do it.
Yeah. Oh, it's funny to look at it that way.
Yeah.
I
So
want
all
to,
this advice obviously depends massively on where you are in your journey, right? Like if
of
it's
course.
early days, maybe your intuition isn't quite up to, you know, isn't quite healthy enough yet for you to listen into it. But for a lot of the people that I see that are a little bit further down their journey, you know, and often they're years down their journey, often they've been, you know, healthy, you know, haven't lapsed for years and years, but there's those behaviors that are still there.
I want to talk a little bit about the pill that you
Yep.
mentioned before. Why is it that doctors prescribe it so early on if someone's lost their period or sort of want to normalize their hormones? Why is the pill just sort of the go-to?
Yeah. The pill is the go-to because the longer that you're not ovulating, so therefore the longer you're not getting periods, the lower your estrogen is, which then increases your risk factors for cardiovascular disease and drops your bone density, which is hard to rebuild. So what they're kind of doing is it's sort of in your interests and it's sort of not, if that makes sense, because they can't manage when your period's coming back, because they can't manage what you're doing with food, nutrition, lifestyle, supplements, herbs, whatever, then it's kind of like, do you know what? It's safer for them to say, do this, and then you don't come back in 20 years with fractures and terrible bone density and kind of whatever it is. It's sort of like the safer thing to do at the time, if that makes sense. So it's also the easy out, right? It is the easy out. But because they're not monitoring you constantly, what if you then don't get a period for another couple of years, or your weight does go back down or whatever, and then you end up with other kind of like health problems? So it's kind of just like, let's just band-aid this, because it's like, I don't actually know what you're doing and I don't know even what I could do to help you to know what to do, if that makes sense.
Yeah.
So that's where it's just kind of like, okay, let's just kind of keep that side of things safe while they're ready to kind of, while they're working on kind of their recovery.
Yeah.
And they sort of know, they're like, oh, look, if we have to just kind of like do assisted reproduction when they want to have a baby, like at least that's an option type of thing.
Yeah.
If you're working with somebody though, like often I'm like, look, we're monitoring estrogen levels, we're seeing things change, and working on kind of like bone density. Sometimes when you're working with somebody, you can do, you can push it out longer because you're actually monitoring all of these things, and somebody's checking in that you actually are moving in the right direction, in terms of trying to kind of get your estrogen up and get you actually ovulating healthily again.
Wow. So what does the pill do in the body to a person?
So the pill basically, most pills suppress ovulation but give you a more constant state of estrogen. So it's not really estrogen, but it's kind of estrogen-like compounds. So that estrogen basically, it's stopping you from ovulating. So, you're not going to fall pregnant, which is obviously good if you don't want to fall pregnant. But then for people whose estrogen is very low, they're giving them this kind of like sort of fake estrogen, I guess, which tricks the body and says, oh yeah, no, don't, estrogen isn't low. Stop leaching all the calcium out of, this person's bones. It's keeping it up there. Oh, yep. Okay. So if low estrogen affects cardiovascular function, here's estrogen. Like, don't be affected, So it's just replacing that hormone. I mean, you're still not ovulating, but it's kind of helping to minimize some of those longer term effects that you're not going to notice for a very long time, hopefully not at all. And because that's not something like, oh, just see if your bones feel weak next week, and if they do, we'll pop it in, like, it's like, no, like it's going to be in 10, 20, 30, 40 years time that you fall over in your bag of dust, right? Like, no, we don't want to find that out later.
Yeah. So why do people then still get a period when they are on the pill?
They don't get a period on the pill. So what they're getting is that if you don't take the sugar pills, you get a withdrawal bleed. So when the estrogen suddenly drops, you get what's called a withdrawal bleed. And so it's just neat to call it a period, but it's not a period, because a period comes a couple of weeks after ovulation.
Right.
So it looks like a period, you bleed like a period, you need a tampon or a pad or whatever like a period, but it's actually just you stopping bleeding because those hormones have now been taken away. So it's that sudden drop of the hormone that you get a bleed.
Yeah. So is it like when you come off the pill, and you want to try and have a baby, and you said that some people find that they're not having a period and they can't have their period. What do you do then? Do you have to reset your system somehow to...
Yeah, exactly. So it depends on why. If it's because of disordered eating and they have had underlying what's called hypothalamic amenorrhea underneath, which is they're not getting their period because their body's not feeling safe. And sometimes it starts on the pill, right? Like, you haven't had disordered eating, you're on the pill, you turn 20, you go live in London, you discover high intensity exercise, you drop the carbohydrates, you've had a very stressful job, you've lost weight, you feel amazing, you don't know, you don't have that checkpoint to say, oh, this is weird, my periods just kind of didn't get it this month, maybe I need to look at my diet and lifestyle. You're still getting those pill withdrawal bleeds, so you're not even any the wiser that you've actually created an underlying hormonal condition while you're on the pill. So sometimes that happens as well. So we work out if it's because of what we call post-pill syndrome, where the pill's just suppressed everything for too long, or it could be they have polycystic ovarian syndrome. With disordered eating, it's more likely that it's just kind of like all under functioning. So we need to still work on those basics: stress, diet, like nutrition, I should say, lifestyle, and then encourage it back with herbs, and or nutritional supplements. So it's finding out what it is, why it is. Get your hormones tested sort of 3 months after you finish the pill, while we're working on all those underlying things, and then kind of create a bit of a treatment based on what's actually happening.
Wow. And if a young person loses their period, I guess during those early development stages of puberty, and they don't regain it till they're in their 20s, could they skip puberty? Is that how it works, or is it become a delayed puberty thing?
It's a bit delayed, but I mean, often you'll actually still have gone through puberty by the time you get your period. You probably already have pubic hair, maybe starting to grow like breast tissue and things like that, and then the period kind of comes. So they still have gone through puberty, if they had their period at all in that kind of time, and they grew those secondary sex kind of characteristics. But it's more just that they haven't kind of like their cycle hasn't really regulated, hasn't had enough time to regulate. So it'll often just take a little bit of time in their 20s for that to regulate. But if it comes back and it's in their 20s, then usually, and it comes back and it's regular, then that's like a really good result.
Yeah. And restriction and stress, those sorts of hormones, and I guess that stress that you put on your body, can that also affect other hormones in your body in terms of like your sleep and other things like that?
Absolutely. So everything interplays together so that, the stress, which is high cortisol, affects your thyroid, affects melatonin, which is your sleep, can affect insulin, which is your glucose, and all of your hormones as well. So stress is a huge part of all of our hormones, and it's what we're seeing more and more and more today. And that's why things like deep breathing, relaxation, meditation is just kind of so important.
Yeah. And just lastly, on a quick little note, what advice can you give to someone in terms of learning their body and their hormones and knowing how to have that healthy balance to support? Like, how can we support our hormones daily?
Yeah, I think the most important thing is to get adequate. This is so boring. Is to get like not for me, but like it's just basically like live a moderate lifestyle is what I'm going to say. Like it's not like you can do this 5-point plan. It's like just if you can try to get adequate sleep in every night, 8 hours. Do a relaxation mindfulness app or something like that for 10 minutes a day. Move your body a little bit, but not too much, and make sure you're eating at least those 3 regular meals containing that protein, good fat, something fresh, and a starchy carb. That is the underlying thing that you need to start with no matter what.
Yeah. Well, that's awesome. And I thank you very much for coming on today. And I've learned so much about hormones in my body. And as I said, your book has just been phenomenal in my journey as well, learning about the different types of hormones and the role that they play in your body. And I really think education and knowledge is power. So thank you for coming on today and sharing everything that you know.
Amazing. Thank you so much. Thank you for having me.
All good.
And if you want more info, you can put my info in the show notes, but you can just head to my website, belindakirkpatrick.com.au, and everything's there.
Great. And you've been phenomenal. And you're based in Sydney?
Yes, I'm in Sydney, but we also do Zoom and Skype and all those online things around the world as well.
Awesome. Thank you so much. And thank you everyone again for joining us for another Secret Sunday session. And we'll join you again next time. But again, thank you, Belinda, and the incredible work that you're doing is really making a difference. So thank you.
Thank you. Thanks for having me.
Bye.